Hi, my name is Ashwin Kaur and my student ID is 1655852225. Before starting the video, my friend will take 360-degree round of the room. Now I'm ready to perform my procedure for dressing change. Hi.
Hello.
How are you?
I'm okay.
Okay. My name is Ashwin Kaur and I'm your assigner today. So may I know your name first?
Yes, my name is Brinderjit Kaur.
Okay. Your date of birth?
16 February 1997.
Okay. Can I check your ID band?
Yes.
Okay. Yes, it perfectly matched to my documents. So according to doctor's order, I'm going to change your dressing. So would you allow me to do that?
Yes.
Okay, thank you. So before starting the procedure, I have to do my quick hand hygiene. Maintain the privacy of the patient. So shall we start?
Yes.
Okay, before starting the procedure, I will ask you a few questions. Can I? Okay. So do you feel any kind of pain right now?
Yes, a little bit.
Okay, so if I give you pain rating scale, what rate would you like to give from 0 to 10? Well, 0 for no pain, 1 to 2 for mild pain, 5 for moderate and 10 for severe pain.
2 for mild.
Okay, 2 for mild. Do you need any kind of medication for that?
No.
Okay, you have any kind of allergy from any food substance or medication?
No.
Okay, so my patient, she rate 2 on pain rating scale and she don't need any kind of medication for that. So before starting the procedure, I have to do my quick hand hygiene and I'm going to elevate the bedside for my comfort levels so that I can do my procedure well. Now I'm going to spread the sheet under her arm to prevent the leakage and drainage so that I can prevent the linen. Going to put the sport armrest under her arm for the comfort level. Okay, are you comfortable in this position?
Yes.
Okay, perfect. So now I'm going to start my procedure. Firstly, I will do my quick hand hygiene and maintain all the equipments that I require during my procedure. Firstly, I will fix my bandages that I need to manage my wound dressing. 1, 2, 3, 4, and the last one that I need for the documentation of date and time of wound dressing. And now I'm going to fix my garbage bag for the disposal of waste. Okay. So before opening the tray, I have to do my quick hand hygiene and I have to maintain the sterile triangle, that is patient, garbage and tray, tray, garbage and patient. So I am going to open the tray. For that, I have to hold the sheet within 1 inch border to maintain the sterility of the tray and the equipments that are present inside. So now I am going to open the tray firstly away from me, one side, either side, and towards me. Going to manage the sheet and manipulate all the equipments that I need during my procedure. So that in tray I have 4x4 gauge pieces, 2x2 gauge pieces, and I have 2 forceps. Okay. So I'm going to put the forceps within 1 inch border to maintain the sterility of the equipments. Now I'm going to add things like normal saline to clean the wound of the patient, and I'm going to pour on from the top. And this is the new opening, and I already documented the opening of for the date and time of the normal saline. Now I'm going to add some extra things like extra gauze, and I'm going to open and pour in the tray with the help of banana peel method. Okay, this card, and I'm going to add the Q-tip to measure the length of the wound. So now I'm going to put my gloves, sanitize my hand, and pair of clean gloves. And now I'm going to assess the wound. The location of the wound, that is right forearm, and I'm going to take off the dressing, and I have to take off very gently so that the patient don't feel any kind of pain. Okay, so while observing the bandage, there is no serosanguineous fluid present, and the small amount of blood is present which is pink in color, and it is a good sign of healing. And there is no odor, no pus formation is present. And I'm going to discard the dressing. Okay, now I'm going to assess the or inspect the wound, and for that I have to palpate it, and palpate it very gently. Do you feel any kind of pain?
No.
Okay, she don't feel any kind of pain, and the wound that is well approximated and closed. There are no sutures or no staples are present. Now I'm going to measure the length of the wound, and at the edges of the wound there is few amount of erythema is present, like reddish in color. So I'm going to measure the length, going to hold the forceps, and with the help of Q-tip I'm going to measure the length of the wound. Okay, going to measure with the help of scale. Okay, it is about 7 centimeter. Going to discard. Now I'm going to clean the wound. Firstly I have to discard my gloves and sanitize my hand, put on the new pair of gloves. Now I'm going to hold the forceps 1 and 2. Now I'm going to take 2x2 gauze piece, make a dumpling, put in the solution, squeeze the extra, and I'm going to clean away from me from head to toe direction in circular motion. Discard. Make a dumpling. Closer to me. Okay. Midline. Now I'm going to pat dry the wound by following the same instruction. Away from me, head to toe direction by tapping. Closer to me. And the midline. Okay. Now I'm going to put the 4x4 gauze piece on the wound for the dressing. Okay, now I'm going to put the forceps within 1 inch border, and I'm going to fix the wound with the help of bandages. 1, 2, 3, and 4, and the last one for the documentation of date and time, and I'm going to document it with date and time with my name and initials. Okay, so I'm done with her dressing. Now I'm going to rearrange all the equipments. Firstly I will take the armrest off, and now I'm going to take off the sheet, and I'm going to discard the sheet. Okay, going to discard my gloves and do my quick hand hygiene. Are you comfortable?
Yes.
Okay, so here is the bell. Okay, if you need any kind of help you can call me and I will be there to help you. So I'm going right now, I'm going for the documentation and going hand it over the physician for the further interventions. Okay, so if you feel any kind of discomfort just tell me. Okay, so I'm going to rearrange your bedside for your comfort level.
Thank you.
Okay, thank you. So I am done with the procedure. So before finishing the video, my friend will take 360-degree round of the room. Thank you.